Hello and welcome, everyone. Thanks for those who are kicking it off by introducing themselves in the chat. We'll give a chance for folks to come on in. Please continue to do that. We're so glad to see you here virtually today. We want to welcome you to this webinar on the value of connection in mental health supports for Asian American, Native Hawaiian, and Pacific Islander elders. This webinar is brought to you by two HRSA-funded National Training and Technical Assistance Partners, also known as NTAPs. My name is Ariel Mather, and I am the Senior Program Manager for the National Center for Equitable Care for Elders. To provide a visual self-description, I'm a white woman in her mid-30s wearing a blue patterned top. Please note that in this webinar today, all participants are muted and your cameras are off, but we do want to hear from you. Folks that are already introducing themselves in the chat, that's a great way to do it. When you're learning from our fantastic panelists, please do use the Q&A feature if you have questions. If you have any technical support needs, please do message Kara or Juliet in the chat. We'll make sure that folks have as much information as possible. There, you can also see keyboard shortcuts on the slide, as well as the option to turn on closed captions. There are other access needs. Again, you can message Kara or Juliet in the chat. For my own access needs today, I will be referencing a script. The slides will be shared in the chat as well if you do better following along. We'll also send that out to folks via Zoom with all of the resources from this session within the next week. All right, so the Association of Asian Pacific Community Health Organizations, or APCHO, was formed to create a national voice to advocate for the unique and diverse health needs of Asian American, Native Hawaiian, and Pacific Islander, or AA and NH/PI communities through advocacy, collaboration, and leadership. So many of you may already be connected on social media or through the newsletter, but please do stay in touch with them. And for NCECE, we are another, again, training and technical assistance partner through HRSA. We're focused on the health and well-being of community dwelling older adults. We'd love for you to learn more about our center if you're not familiar, as well as join us for some of our future learning opportunities. So when you signed up for this session, you may have seen these learning objectives, but we're wanting folks to walk away from the webinar today being able to describe cultural and structural factors that impact access to mental health services for older AA and NHPI patients, to explain the relationship between culturally responsive care and overall health outcomes for this population, as well as utilized some really fantastic shared strategies to establish trust and rapport to improve patient-centered communication. All right, so 1 year ago today, actually to the day, which we did not plan intentionally, but that's kind of cool, we hosted a webinar on preventive services for Asian American elders. So this session focused on the relationship between chronic conditions and mental health. So our panelists shared samples of culturally responsive programming and staffing, as well as samples of unique pathways for mental health screening through a no wrong door approach. This will be linked in the slide deck that you'll receive. I believe we'll also put it in the chat, but since you're here with us now, we'll engage with this content live, and then you're welcome to watch the recording if you weren't able to join us last year. All right, so for those that might not have been able to join us then or are newer to this topic, I did want to briefly touch on some background before we hear from our panelists. So we are all aging, but cultural, geographic, linguistic, and ancestral differences drastically impact how we age. In addition to in addition to being impacted by ageism and ableism, elders may experience compounded disadvantages to healthy aging based on the intersections with other aspects of their identity, excuse me, including gender, race, ethnicity, sexual orientation, disability, ancestry, and more. Further, when discussing AA and HPI elders, we cannot ignore the reality of migration, immigration status, and how those impact their access to services and resources differently, with having some having high access and others being excluded altogether. So for example, only recently did certain Pacific Island territories gain access to Medicaid and Medicare. There are countries in the Pacifica who are affiliated with the US, either through compacts of free association or as territories, that still lack access to US citizenship and are often forced to migrate to and from the continental US to receive services. So, leading to disconnection, loss to follow up for health centers, other complications with their continuity of care. And despite politicians' focus on the southern border of the US, we know now that Asian American populations are the fastest growing population of undocumented immigrants in the US. Fear of deportation and tenuous immigration status often lead to decreased access to resources and create further stress, isolation, disconnection from community supports. And all communities of color experience racism, varying degrees of xenophobia and general erasure from data. And race-related stress has extreme impact across whole human health, and thus is critical that mental health programs, outreach, staff are culturally responsive and trauma-informed. So we're looking to really disaggregate data that lumps all Asian Americans into one category and all Native Hawaiian Pacific Islanders into one category so we can better understand the needs of individual subgroups within diasporic AAs and HPIs. Just a little bit more context, some considerations for culturally responsive care. There's actually no direct translation in many Pacific Island languages for mental health. Instead, it's considered more as overall well-being and balance of emotional and spiritual health. The concept is that body, mind, spirit, and the world are all interconnected and affect each other, and that we cannot separate individuals from their lived environment. Due to ongoing stigma around mental health, both AA and NHPI communities, it's critical that programs are not just culturally adapted, but are culturally grounded, meaning that they are ideally designed by, with, and for the specific population they aim to serve, and at a minimum are adapted to meet the specific needs of that population, as well as including culturally resonant imaging, messaging, and recommendations. Lastly, many Asian American, Native Hawaiian, and Pacific Islanders bear a complex historical legacy that significantly shaped their relationship with healthcare systems. The experience of colonization, exploitation, and displacement has left deep scars that continue to influence perspectives and challenges these communities face, including their interactions with institutions like healthcare systems. In order to see meaningful change in health outcomes for older AA and HPI folks, we must understand not only an individual patient's needs, but that the context of their personal, ancestral, community level trauma. So thanks for bearing with me through the level setting. Again, this might be content that you're familiar with and you're looking for some real life examples of this work. If you needed a little bit of context, hopefully that was helpful. But we're really excited to jump into our panelist presentations. We're going to hear a little bit about the programming and services from these three wonderful individuals and their programs, and then we'll be able to have hopefully a robust discussion together to dive more deeply into some of these topics. So I am going to briefly read their bios, and then they'll be able to also introduce themselves as they go forward. But first, we're going to hear from Dr. Lee-Ann Heely, Director of Health Equity at the Hawaii Island Community Health Center, located in Kona on the Big Island in Hawaii. Lee-Ann leads activities related to quality improvement transformation and its ongoing development and implementation that support the Department of Health Equity and the strategic plans of Hawaii Island CHC. Lee-Ann serves on the APCHO board, as well as the Health Center senior leadership team. As an advocate for Native Hawaiians, Pacific Islanders, and other marginalized groups, Lee-Ann's passion for leadership, organizational transformation, and innovation, growth and development from a community-centric approach on health equity and SDOH best practices have helped to increase the quality of care delivered to children, families, and elders of vulnerable populations. See little hearts popping up, which is great. Got some fans, Lee-Ann. After Lee-Ann, we're going to hear from Gerard Manuel, Director of Wellness Services from Asian Americans for Community Involvement, or ACCI, located in San Jose, California. After 25 years in the municipal sector, Gerard joined ACCI in 2018 to provide strategic leadership and oversight of wellness and community services that promote healthy independence, healthy lifestyles, and safety and security. Gerard coordinates ACCI's implementation of the API Community Health Worker Partner Network and the Silicon Valley Healthy Aging Partnership. He also leads agency-wide integration efforts, wellness strategies, and initiatives, and has developed programs that helped advocate for, create, and support the community. And then lastly, we will hear from Eunice Chun, Executive Director of Korean American Community Services, or CACS, located in San Jose, California. Eunice promotes community engagement and acts as a navigator for clients, many of whom are new immigrants unfamiliar with social services, benefits eligibility, and civic duties. She advocates for improving the quality of life for immigrants and underserved populations by increasing access to critical resources and community benefits, as well as providing opportunities for civic involvement. Eunice strives to amplify the voices of marginalized community members and advocate for equal opportunities and access to resources for all. So I hope that's impressive. I think that even just reading through bios, these are folks that are very, very qualified to give their insights on this important topic, and we're so excited to learn from them. I'm going to pass it over to you, Lee-Ann.
Aloha mai kako, everyone. Thank you so much. Before I begin, I'll be with you for about 10 minutes before I pass it along to Gerard and Eunice. Just a big mahalo to the National Center for Equitable Care for Elders and APCHO, Ariel, Kara, and Juliet. Thank you so much. Good afternoon, good morning, wherever you are. I'm Lee-Ann Heely. I'm excited to be here. I'm the director, as Ariel mentioned, at Hawaii Island Community Health Center. Many of us on this Zoom webinar knows that across the nation, we have roughly 1,400 FQHCs. FQHCs were started during the War on Poverty back in the 60s. So Hawaii Island Community Health Centers is one of those 1,400. Collectively, we have served 3 million plus and growing. Based on the needs. Our mission is, as stated, Hawaii Island Community Health Center promotes lifelong health and wellness through quality healthcare that is comprehensive, integrated, culturally responsive, and accessible to all. We also are committed to the vision of a strong, healthy, nurturing community, and our values are there below. We focus on health equity, meaning we remove barriers and provide fair and just solutions for people that are in most need. Everyone has different needs, so we customize according to the need at hand. Next slide, please. So Hawaii Island, for those of you who have been here, you're familiar with our landscape, but for those who have not and have yet to visit us, we service an area that consists of 208,950 people on island. We are the largest of all Hawaiian islands. Looking at the number above, 20.5% are at age 65 or above. So that leaves us with a total of 42,659 elders. Here in Hawaii, the word for elders is kupuna. And so that's the number that we focus on as we do our work. The image to the left on this slide is just a quick snapshot of the community health worker team within my Department of Health Equity. These represent the number of outreaches to a specific group. We are doing our best to gather more accurate data, to disaggregate it, as Ariel referenced, that there is too much aggregated data, which is skewing a lot of our research and promise for solutions that are equitable. Next slide, please. So as a federally qualified health center, we report to HRSA, and we are required to represent our numbers, our patient base in the UDS system. We have a total patient base of about 36,947 and growing. Altogether, we have 15 locations throughout the island, as well as we recently entered school-based health centers. We've got a fabulous project there. So we are close to the 20s, low 20s, in terms of our health center locations. We have a total of 6,640 patients that are 65 and older within Hawaii Island Community Health Center. Those patients that choose to categorize in a specific race or ethnicity represent 20,695 or 63.49%. A breakdown of the Hispanic, Latino, Asian, and Native Hawaiian Pacific Islanders you can see there. A lot of our work involves working with many of the diverse populations across the island and their kupuna, understanding their protocols, their needs. As you see there, Native Hawaiian Pacific Islander is the highest representation, about a quarter of our total patient base, 7,728 patients. Next slide, please. Now, in terms of our patient status, those patients receiving care at Hawaii Island Community Health Center, just a little more data for everyone here. About 7% are receiving mental health services support, about 6% enabling service support. Enabling services primarily deals with the social determinants of health. So if you can imagine places where we live, learn, work, and play, many of our communities are rural, and so they're off-grid. Perhaps they don't have electricity to keep their medication cold or at temperature in order to improve on their care plan. Medicaid and Medicare, many of our patients, we've got a high percentage of patients covered with Medicaid as well as Medicare. And if you can imagine the federal poverty line, in 2022-23, the Alice report reported that our entire island we're looking at 50%, close to 50% that are living at the poverty line or below. So there is great need across our island. The team of community health workers in health equity, as well as patient navigators, and the entire organization works hard and swiftly to meet the needs of our communities. Next slide, please. So the reason I was very excited to be asked to join this panel with Gerard and Eunice. In terms of our kupuna care, our elder care, as an organization, for example, our behavioral health department provides support to our geriatric or kupuna population by doing cognitive assessments that assist providers in Hawaii Island Community Health Center. We recently went through a merger. We're the parent company of that merger with another health center on island. And because of that merger, we have switched to the Epic platform to capture our data on all patient care. So within that Epic, there's been a platform built out for us to better capture the data on our kupuna. So there is a geriatric screening platform created so that we can, again, look at disaggregating the data to better understand the needs of our patients. This particular slide, Caring for Kupuna, you'll see Heely Na'i on the left. Heely Na'i is the name of our kupuna program gifted to us by a kumu Ke'alaching, who is Native Hawaiian, lives on the Hawaiian homestead of La'iopua. Heely Na'i simply means trust. Trust, meaning I am a trustworthy person, you are a trustworthy person. Our kupuna have a lot of fear and distrust of organizations specific to healthcare for obvious reasons of the historical trauma that the state of Hawaii went through during the overthrow of 1893. And to date, we have been dealing with and navigating many complexities of healing specific to mental health and wellness. So through this Heely Na'i program, this program stands as a pillar. And with this pillar, the focus was to expand beyond Heely Na'i, expand beyond this, meaning currently this program lives in the outreach department. But as I referenced, EPIC with the geriatric platform that we can better capture data, that will allow us to better target the needs of our kupuna. Next slide, please. This is a very special slide. I particularly love to show pictures of our work in outreach. So the team collectively will share pictures. And starting in the upper left, you'll see the gentleman, a kupuna in the purple top. He has been instrumental in sharing his mana'o about wellness and care for kupuna. As we know, because of the overthrow, the effects of the historical trauma, the intergenerational trauma, having programs that are informed, trauma-informed care programs, trainings are essential to preparing our team members to best service our kupuna. The gentleman in the white top next to him is Kumuke Ala Ching. He is a blessed figure, a navigator and a guidance, and offers much guidance and an advisor to all when we're seeking information to understand our communities, whether it be Lahui, our community of the Native Hawaiian community, or other diverse communities that are coming to Hawaii Island. In the second row, you'll see me pictured there with the kupuna in a brown top. Ariel mentioned the diversity of kupuna and elders from many places. So when we talk about mental health and wellness, we have an island, a county that has been welcoming others from places far away, such as Micronesia. This woman was the first woman to relocate to Hawaii County to better care for her family. So think about that: climate change, lack of workforce, lack of economic opportunity. She has had to leave her homeland. Although she's not forgotten her culture, she has had to leave her homeland, her people and her communities that she so loves to make a better life for herself and her family. The picture below that is one of our community health educators, Kamaile, and she is speaking with a kupuna unsheltered here in Hawaii. And this picture represents one of many other kupuna that are unsheltered here on Hawaii Island. So we go to them, we build relationships, again, back to Heely Na'i, building trust, sitting with them, having some conversation, checking on their safety, on their needs. The woman below that picture that I'm giving a beautiful hug to, this woman came from Hoshrai, part of the Federated States of Micronesia. Again, relocating to Hawaii, leaving her homeland, certainly did not forget her culture, her customs, but she was very blessed that Hawaii Island Community Health Center was able to understand the needs of Hoshraians who are now living, working, residing, and integrating themselves into Hawaii County. She was very blessed. We had a very special cultural celebration day. This is all part of the mental health and wellness. Cultural identity is a positive factor against adversity that many of us can benefit from. And so the value of connection, the value of reaching out, the value of talking story with them. You can certainly see other pictures here. The picture with the, that looks like they're on the farm, a grassy landscape with blue tops, Claudia and Walter. We do much outreach to the migrant farm workers. Many farm workers come from Hispanic communities, but certainly we've been identifying with Thai, people coming from Thailand, relocating, Filipinos, of course, a big population here on Hawaii Island, and other pictures here also indicate the ways and strategies that we outreach. The individuals in the red tops, we hold a special day, Women's Heart Health, honoring women, caring for them, offering them health and wellness activities, and of course, storytelling and a time to connect. And this is for kupuna as well, so reaching out to all. Really, our health center offers wraparound services from cradle to grave. So from keiki, which means child, to kupuna, which is elder. And that's just our passion for serving our community. Next slide, please. What are our strategies, caring Una? So again, the strategy that I personally have created and gotten the support of our leadership at the Hawaii Island Community Health Center was, of course, building the Hili Na'i program with the blessing of Kumukeala. In 2019, we had a grant opportunity to partner with our Hawaii Fire Department, community paramedicine. Fire department personnel would go out to that rural community and check, you know, go door to door and check on our kupuna. So we have that community paramedicine partnership, first program in the state. We've got the Kupuna Task Force that Hawaii Island Community Health Center offered to initiate with the county, followed by additional grants, projects, and workshops. Next slide, please. Now, where is the state of Hawaii going in terms of aging, ability? We have one of the fastest growing populations in the state, highest life expectancies. There are shortages in healthcare. There's great concern what the workforce will look like. Lack of affordable housing, nursing facilities and services. These are all concerns. Families are struggling to get respite care to care for our Hawaii's aging population. Next slide, please. As a collective, so Hawaii's plan to care for kupuna, we have to come together as a collective. Our kupuna often share their wisdom and their mana'o. We call that ike kupuna. They are the keepers of ancestral knowledge. So we go to them for advice, for guidance and wisdom in what we face every day. We certainly can take personal action. And in speaking with the kupuna within my own family, my own ohana, I asked for some words of wisdom, and they said, appreciate all that you have, be the best person you can be, and be blessed and grateful for all that comes your way. Certainly developing partnerships with Native Hawaiian health centers such as Papo'ola Lokahi, Hui Malama Olana Oiwi, and others. In 2018, Hawaii City and County passed a bill for our state to be an age-friendly place. And so the University of Hawaii has created an aging-friendly center. And we have now across the state Kupuna Collective where we can get involved and participate. Certainly building relationships with community and government. That's where my department resides currently, strengthening those relationships. And of course, looking ahead to the workforce. What are the needs that we have to focus on in order to build capacity to care for our aging in place kupuna? Words of wisdom from Kumukeala before I wrap this up. Kumukeala says, we have to build a place where generations are trusting generations. So he says, e hili na'i kako. And simply put, we just have to build relationships through trust, through willingness to be courageous, to face what stands before us. And for those of us that have ancestral ties and lineage, remember that our cultural identity, our connection to land, to place, to akua, to our gods, and to lahui, our community, serve as positive protective factors for all of the adversity that we are facing as we look to shift systems. Next slide, please. Okay, mahalo nui. I'll turn it over to Gerard.
Thank you, Lee-Ann. Really appreciate this and amazing programming. Hi, everyone. I'm Gerard, and I work with Aki. Aki's mission is to strengthen the resilience and hope of our diverse community by improving their health and well-being. Aki began its journey 50 years ago as a community-based nonprofit organization in Santa Clara County, primarily supporting and advocating for refugees and immigrants. Over the years, we have expanded our services to meet the growing needs of our community. Today, Aki is proud to offer a wide range of services, including federally qualified health center. We operate a health center and dental services in Santa Clara County, providing primary care, integrated services, integrated behavioral health services, enhanced case management, oral care, and patient navigation services. We have a robust behavioral health services program that offers mental health support and services to people of all ages, from youth to older adults, in both clinical and school settings. In my department, the Community Wellness Services, we focus on health, wellness, and engagement by implementing safety net programs, health education, substance use prevention, and capacity building activities for youth, adults, and older adults. Wellness Services partners with municipalities and CBOs, community-based organizations, to build and strengthen our community. Santa Clara County is also an age-friendly county, and we work very closely with many of our partners to support the growing needs of our aging community. No matter how the community finds Aki, our services and programs are made available regardless of race, ethnicity, immigrant status, or ability to pay. The Aki team is diverse, with 86% of the staff being people of color, and together we speak over 40 different languages. Next slide, please. One of our long-standing programs is the Senior Wellness Program. Given our roots as a community-based organization that has expanded to include primary and behavioral health, Aki is uniquely positioned to integrate programming and wraparound services. Senior Wellness Program is an established presence in the community. We are a senior center, and we have developed a strong network to support and implement healthy, active aging strategies. Our staff is trained in more than 10 evidence-based programs. We coordinate senior nutrition and facilitate activities and services to help older adults age healthy and well. Our Senior Wellness Program collaborates very closely with our behavioral health team to provide workshops that help clients navigate their mental health needs, address concerns related to stress and depression, and increase their awareness of available support. We also work very closely with our health center to support health and wellness services through screenings, hypertension education, falls prevention, chronic disease workshops, and combating misinformation. The impact of COVID-19 has been profound, and we have leveraged our assets and partnerships to continue providing strategic and culturally specific services. Next slide, please. Senior Wellness Program has leveraged staff expertise, agency-wide services, and its community network to further help older adults navigate challenges prevalent during the pandemic. We increased our efforts in deploying targeted outreach and services that is culturally responsive and appropriate. In response to digital literacy and technology access needs of marginalized older adults, we've partnered with Older Adult Technology Services by AARP and helped vulnerable seniors in our community stay connected and informed. Aki guided the community outreach in low-income housing and helped with language translation, and worked very closely with Older Adult Technology Services and their staff resources, and provide information and facilitated workshops on telehealth and Zoom. Our workshops also work together, very closely together, in connecting them with other technology-based activities and programming in the community. Our work also increased access and deployment of culturally appropriate evidence-based programs. We have partnered with Alzheimer's Association and helped translate dementia education workshops in Mandarin and Vietnamese. We've worked very closely with Stanford Healthcare to translate Matter of Balance in Mandarin. And we have partnered with Korean American Community Services to introduce and deploy enhanced wellness. In many of our programs and services, the big thing that we typically ask at the end of a workshop, we send out a survey, and in that survey, many of our seniors self-report by participating in our programs, many feel less lonely. So it's really been an exciting time for Aki, and we have been very proud to have been working with our community. We're also proud to be the lead agency for the Silicon Valley Healthy Aging Partnership. And that partnership consists of agencies including Stanford, the Portuguese Service Center in our community, also working with the City of Sunnyvale and Korean American Community Services. And we are also the lead agency for the API Community Health Worker Program, working with 8 other API agencies to provide health education throughout Santa Clara County. These initiatives allow us to extend our reach, leverage, assets, and impact, ensuring that our community receive the comprehensive care and support they need. I'm going to go ahead and turn this over to Eunice and have her cover the Korean American Community Services. Thank you.
Thank you, Gerard, for the great work and on your partnership. Hello, everyone. Thank you for inviting me to this webinar. I'm Eunice Chun, Executive Director of Korean American Community Services. While we are a small organization, not a healthcare provider, I'd like to share how a local community-based organization can play a critical role in supporting elders' health and well-being. I'll be discussing some of the strategy and best practice we've used with Korean elders with a focus on culturally centered approaches and enhanced wellness programs for their well-being and mental health. So as the sole nonprofit social services provider and advocacy agency for Korean Americans in Santa Clara County, our organization's mission is to improve the quality of life of all Korean Americans with a focus on those who are most at risk, including seniors, by increasing access to community resources and providing opportunities for community involvement and civic engagement. Through our programs and services, we try to bridge the gap between the Korean community and the available resources in our local communities. Next slide, please. So here are some of our annual impacts by numbers. We provide Korean hot nutrition lunch every day, average about 70 seniors per day, and totaling over 16,000 meals annually. We provide social services and make our community members access to public benefit. And we serve over 2,000 seniors and providing 7,000 units of service annually. In addition, we actually offer various senior health and wellness programs with over 20,000 units of services, including health seminar, health screening, and various physical activities. And over 98% of our program participants reported that they feel less, stress relief and reduction in depression through this program participation. We also conduct monthly home visits to over 200 isolated seniors living in 10 different senior housing throughout the county. So during this visit, we not only just deliver Korean hot meals, we provide health education, recreation, technology support, and social services. So through both our senior nutrition program and also our senior home delivery outreach program, we try to create spaces where seniors can come together, share meals, make friends, and access to critical resources. And also our access to technology program has offered to over 500 seniors. We help them stay connected with their friends, loved ones, as well as critical resources in the community. And we also host various cultural educational events throughout the year. We engage over 2,000 participants, both for Korean and non-Korean community members. And we accomplish our impact through cultural competency and bilingual and bicultural staff. The 100% of our entire staff are immigrant, bilingual, bicultural, including myself. So we do understand and respect the cultural needs of Korean community. And we have always the commitment to best practices. And also we do this through strong community partnerships. Next slide, please. So in partnership with AKI, we have implemented this evidence-based program, enhanced wellness program, which connects participants with the personal health and wellness coaches to improve their physical, emotional, and social well-being. So let's watch a short video. I'm an executive director at Korean American Community Services. So part of a community health worker program, we conducted this evidence-based program called Enhanced Wellness Program. So during this program, our community health worker designed this program to advance their social, physical, and mental improvement by doing different activity like brain exercise, physical exercise, and create space for socializing. So it is so beautiful to see those 80, even 90 seniors come together once a week, learn some activity, and share their challenge or laugh or stories. So it is so beautifully designed. So we are the only Korean ethnic food provider among 40 different sites in Santa Clara County. We are serving over 70 meals per day, and 30% of participants are non-Korean and mostly AAPI seniors. The work we do through community health program or the senior center activity or senior nutrition program, we literally change the lives of seniors and save their lives physically, mentally, and socially. Thank you. So we just completed our first cohort, which you just watched. We currently have a second cohort underway, and we'll soon launch the third, this enhanced wellness program. So by the end of the first cohort program, the participant reported a significant improvement in their physical and mental well-being. This program has been highly successful because it was designed with a cultural sensitivity and tailored specifically for at-risk Korean seniors. And none of this would have been possible without the strong partnership we built with the CHW network through AKI. So in conclusion, there is a great value in connecting with the strong partners and the local community through cultural competency. Thank you for listening.
Amazing. Thank you all. It's great to even just get a quick peek at your programming. Yes, there's a few more slides there. It's wonderful, to have you all here in general, but to hear a little bit from both Aki and Cax in your partnership development together. It's really great to have both of you here and be able to explain some of that process. We are going to have at least about 10 minutes of just discussion. We have 60 minutes together as a group, and we want to fit in as much information as possible, trying to give some insights, snapshots into programming that already exists, but it might be so valuable for folks to just listen a little bit to discussion across these three wonderful panelists and some of their overall reflections and insights that hopefully will be of value for folks no matter where you're at in potentially the development of, the implementation of, or the improvement of some programming in your own areas. So you might see on the slide deck, if you're following along, that we have several questions prepared ahead of time. We'll see how many we get to. We'll start with a few, but I also encourage you to use the Q&A feature, use the chat box. If you have immediate questions for our panelists, or as we're discussing, if things come up for you, we do want to take at least a few minutes at the end of the hour to ask pass them along to our panelists. So just a plug there for thinking about your questions or comments. For now, though, we're going to talk to our three wonderful panelists. I'm going to start with a question around asking you to share more about your why. So how were your programs built in response to the mental health needs that were identified in your communities? Now, I think all three of you kind of touched on the need, but I think it's great to really emphasize, no, this is the true heart of it. This is the why we're doing it. We'll go first just in the order of the panelist presentations, and then we'll mix it up. So Lee-Ann, can you share more about your why?
Sure. Thank you so much, Ariel. My why has really been inspired first from an individual, within myself, because I am Kanaka Maoli. I am Native Hawaiian, and so I understand the trauma, the generational trauma. So as I referenced 1893, the overthrow of Hawaii left much of Hawaii, all of Hawaii, in a very tragic place. With their mental wellness. As we know today, in 1921, Prince Jonah Kuhio Kalanianaole formed the Hawaiian Homes Commission Act, signed into law, offering Hawaiian homelands to Native Hawaiians. To date, the Department of Hawaiian Homelands has housed 10,000 Native Hawaiians, and 29,000 remain on the wait list. So there is such great need. When we talk about mental health and wellness, it goes beyond, it goes very deep, beyond the isolation factor. We are dealing with the intergenerational trauma. So that was the inspiration behind the Hili Na'i program. Having that model would allow me to leverage that as I welcomed and met other culturally diverse populations on Hawaii Island. Mahalo.
Thank you, Lee-Ann. And for me, I think for me, my why really started with my folks, my parents. They started me out young and got me engaged in community service and pointing out the importance of being there for your community. And it's been kind of my calling, where I really wanted to provide energy and focus and how we can reach our marginalized communities and setting up services and activities to kind of address that. For Aki, one of the biggest things I could see immediately happening during COVID was when we had received a phone call from the community from one of our residents, just completely disconnected and feeling a little bit nervous about how to navigate the COVID environment, and really reached out to our staff and our team, and we saw the immediate impact of what was happening to her mental health, and to her just kind of navigating the services. And it was great watching the team jump into action, and connect her with services, connect her with food and support that she was looking for. But more importantly, we saw her grow into our program. She started to join our services and activities. And recently, she sent us an email saying that she just traveled with someone that she met through our program. So it kind of reinforced the whole aspect of engagement, and making sure that we're facilitating opportunities for our seniors to engage and connect with others.
Thank you. My wise, as a woman of color and Asian immigrant, actually, I face challenges every day. So when I think about our seniors, how the urgent needs they are facing every day, I cannot imagine. So as an organization, before COVID, we were more focusing on just the critical issues like food security or access to public benefit or housing support. But since the COVID, and the rise in anti-Asian hate crimes actually intensify the challenges that our community members already faced, which was language barriers, cultural differences, and isolation. And those really leading to mental health crisis in our community. And as you aware or not, actually South Korea has the highest suicide rate in entire nation, around the world. And also Koreans has the highest suicide in Santa Clara County. Those numbers and the data really is heartbreaking. So as a organization, we really try to respond to these urgent needs, and we expanded our outreach to make sure our seniors have access to the services they need. And our goal was to reduce the isolation and foster connection and create a support system to improve mental health and overall well-being in the community.
Amazing. Thank you all for sharing. Obviously, not easy that the needs are there, but really appreciate the thoughtfulness that you all are approaching those concerns with, and developing programming in response. We had some appreciation for that in the chat. I wonder if all three of you want to talk just a little bit more about the building blocks of these types of programs. So there could be folks in the audience who may be seeing the need in their communities, maybe seeing some overlap in some of the needs you're describing in your own communities, but it can be daunting to think about how are we going to set this up? Clearly, we can't have a full discussion about that today, but I'm curious about building blocks when we're thinking about developing culturally responsive programming and outreach. I'd love to hear a little, some insights from you all as far as folks that are thinking about developing that. So we'll just go backwards from what we did before. So Eunice, do you want to start?
Sure. When I thought about this question, it came to my mind that the community engagement is maybe the top priority. You can do either conducting needs assessment or collaborating with the ethnic group leaders who may know the community already, so they can help identify the cultural, linguistic, and social needs of the population to try to serve. And of course, cultural competency and language accesses are vital, but there's the more important thing, in my opinion, is offering culturally tailored education or health services that address stigma is very essential. So for example, at our agency, when we had like a domestic violence workshop, we named the event under building healthy relationship instead of say domestic violence prevention. So to increase the attendance, and remove the stigma. So as a more direct, those title can really differ community members from participating. So you have to be understand the cultural, the sensitivity and the stigma when you try to serve those populations.
Thank you, Eunice. And I think for Aki, definitely one of our biggest success in developing and reaching our program and providing our programs to the community is really recruiting culturally appropriate staff. And not just recruitment, but making sure that they have what they need, the training and services that they need to deliver. But I can't really emphasize enough what Eunice just shared about working with other partners in the community space and really turning to people that already have a trusted presence and amplifying that trusted presence. One of the other strategies that Aki has done in the last few years is we have braided multiple sources of funding from local foundations to grants from our local or entities and government programs in the area, as well as statewide and national grants we have applied for. We've braided all of those funding opportunities and have created a network of partnerships with different entities. So we didn't take the approach of Aki can do it all. We knew that we can't do it all, and there's so much need out there. We reached out to multiple partners and we created a coalition and submitted a grant together as a coalition. So this one probably one of the best building blocks I can emphasize is finding the partners and leveraging your assets with other entities that have a lot of strengths and knowing that the community is large enough for all of us to serve.
Thank you so much. So I'll add to what Gerard and Eunice have offered. So certainly we start with understanding our community, and with community health centers, we hire from community. So we become the eyes and ears. We then look to performing community health needs assessment, whether it's for the Native Hawaiian community or Pacific Island communities, for example, that I've had to do a Hawaiian word, ho'olauna, introduction. We introduce one another to each other so that we follow protocol and are able to understand the needs. We certainly are not going to drive the program creation. We're going to develop it after we've gotten the blessing of the kupuna or the leaders of communities. So that has helped to guide us. Also working with our payers, Aloha Care Insurance, for example, in the state of Hawaii, first insurance payer to offer value-based indigenous programs, such as Lomi Lomi, that's massage, hula, aipono, healthy eating, and more. So the value of connection in order to care for kupuna is important. Thank you.
Amazing. Thank you all for that. I want to ask, there's a couple of questions in the Q&A, so we'll try to get through those quickly, and then we'll see if we have time for just a few final thoughts. But the first question we received is about transportation. So for folks who might have some, functional limitations, how do you all, think about providing transportation or helping to enroll in programs where there could be some issues with the actual service provider or the actual engagement with that service? So curious what you all think. Obviously, transportation is a huge social determinant of health. So I'm curious, Gerard, do you want to start?
Sure. For Aki, we actually do a couple of things. We do partner quite a bit with many of our local entities, including our transportation system. We help our community sign up for services that they may be eligible for. But we've also done some specific grant writing with ride-sharing apps. So we've done a partnership with Lyft and Uber, where we've been able to provide some certificates to our folks who are in need. And then we also have a case management team that created a transportation resource list to kind of navigate some of that conversation. But really, I think what has helped us the most is we took our programs out of our facility. Our teams navigated different communities locally, especially low income housing in our communities that are maybe culturally specific. Our teams navigated in those areas, created a partnership and relationship with many of those entities already out there, and we started to bring our services out. So some of our programs are available in the community and they're available in different sites. And lastly, one of the things that we have also expanded because of COVID is we do quite a few hybrid programs available both online and also in person. Is one of the things we saw some folks come back and join our program when we did a hybrid environment because they could no longer drive, but they wanted to be a part of our activity. So we do quite a few hybrid programming.
Amazing. Eunice, is there anything you want to add there?
I mean, we don't have anything new, but I will just rephrase what just Jared said because we do similar things. So before COVID, actually, we provided transportation using our own vans. We bring seniors into our center and did program. But after COVID, we actually stopped that services. But instead, we work with like a BTA, with the local transportation company, help them senior get like a appointment for ride and services, all that. And also we do offer like hybrid, like what just Gerard said, for someone who cannot really travel themselves. Lastly, during my presentation, I mentioned this, that instead of them to figure out how to travel, we actually bring services, program at their home through our, home outreach program. So our aim is currently we are serving around 200, but our aim is to serve more, even beyond Korean community, so that we make sure those isolated seniors connected to not only just critical services, but really with the community.
Amazing. And Lee-Ann.
Yes, so we have an exciting program starting, Street Medicine Outreach Mobile Health Unit, where we go to communities, and you've seen the visual of the Hawaii Islands, so big, the largest of all 8. So it's very important that we not only offer the online platforms, such as Gerard referenced, online platforms, so that we go to community. And certainly we're going to do what we can to reach as many. Also working with the community paramedicine program with the Hawaii Fire Department, enabling us to access our kupuna. Working with the county aging office as well to coordinate transportation and certainly insurance payers. So it's really looking at the resources you have and trying to do the best that you can.
Absolutely. Thank you. I'm mindful of the time. I'm wondering if Gerard or Eunice could type out the answer to the question in the Q&A prompt around more of your meals program. That would be great. And I'll say the other Q&A question. There is a large number of resource slides in this deck that we won't have time to actually go through one by one during this session, but have a lot of culturally responsive materials, things that were tailored specifically for a variety of populations. So encourage you to look through that. Certainly for any of our panelists, seeing the question in there around introducing some complex concepts with mental health, that certainly is going to pose some challenges, but I know that a lot of good material has been developed. And so if there are additional resources that you all can think of that you've done for your patient populations, fantastic if you want to send them along. I want to quickly just get items of business out of the way of saying, I know we're almost at our time. There will be an evaluation that pops up when you leave this Zoom. We would love to hear from you. It helps to inform and improve future learning opportunities. You also see in the slide deck, when you receive it, there's a national training and technical assistance needs assessment. We'd love to hear your insights, all things that just take a few minutes, but really are beneficial as we put together learning opportunities for health centers and CBOs. In our final just 2 minutes, so I'm wanting these responses to all be very short, but I would love just closing thoughts. So we really are so appreciative of our panelists in sharing about their programming, their passion for the work that they do. 30 seconds, any final thoughts that you want to leave folks with? Lee-Ann, can we start with you?
Mahalo nui. So definitely have a cultural lens that you're looking through when creating programs for your elders, regardless of the cultures and communities they come from. They are the keepers of the ancestral knowledge. So getting to know them, understanding them, hearing them, you'll best be able to provide resources and supports that they need. Mahalo nui.
Amazing. Eunice.
Just thank you for the space. I just appreciate all the effort and everyone enjoying the program. I just want to say this, never underestimate the power you hold as an individual level or organization level. It's not all the doctor staff save lives, but even like a small local agency or a staff at any level, you can contribute the well-being of our elders, AAPI, and community members. Thank you.
And for me, thank you so much for having me on the call. I do want to stress that probably the biggest thing I want to say is that we are all a community, and all of us have a lot of strengths in that community. And your biggest set of resources is each other. So feel free to reach out. We're always open. We always want to make sure that we're providing our talents and our skills and our knowledge and helping that move forward. So I'm happy to reach out, and I believe the team here has our contact information. All I charge is a cup of coffee and a quick Zoom call. So it's not a problem at all. We're always happy to work with everybody.
Well, there is never enough time. I'll say that I wish that we could stay much longer and continue to hear all of your wonderful insights. But again, so appreciative of your time. You will all receive materials from this session, including the transcript, the recording, the slides, within 1 week. If you have questions that have popped up that we weren't able to get to, feel free to email them. We're happy to connect you with our wonderful panelists or additional resources that are related to this topic. So thank you all for your time and attendance today. Have a wonderful rest of your day. Take good care.
Thank you.
Aloha.